Of the infectious diseases. So we're going to be looking at some more diseases. We're going to start with respiratory system. So we're going to look at things that are bacterial. So we're going to talk about first some streptococcal stuff, streptococcal pharyngitis or just strep throat, streptococcus pyogenes. The pyo means pus. So you will get these pus-like blisters in the back of the throat. So it is resistant to phagocytosis. They produce some things called, these are what we call virulence factors, by the way. Streptokinases, they lyse fibrin clots, and streptolysins are cytotoxic to tissue cells. So these things cause damage to the tissues. Scarlet fever caused by strep pyogenes. There's what's called an endotoxin, and it's erythrogenic toxin and damages, so from strep pyogenes. The red rash is response to the toxin. Toxin damages the tissues. Diphtheria, Corneobacteria diphtheriae. There's a gray membrane in the throat and tonsils and things like that, which is made of fibrin, dead tissue, and bacteria. And this can lead to blockage of your airway from diphtheria. These are bacterial infections. Pertussis, bacterial infection, pertussis, Bordetella pertussis, the whooping cough. Bordetella is what causes kennel cough as well. Childhood disease that you usually get infects the ciliated cells of your trachea. There's a cytotoxin called tracheal cytotoxin. These are virulence factors that cause disease. Basically the mucus accumulates because the ciliary muco, you guys remember in the cilia, pseudostratified ciliated columnar epithelium of the airway travels up. You get violent coughs to the point whooping, and so bad you can have ribs break and you get the whooping sounds as you gasp for air. So pretty bad. All right, let's talk about tuberculosis and pneumonia. Mycobacterium tuberculosis. You inhale it, and it infects the macrophages of your airway, which are found in the respiratory membrane of the lungs. There's a walled-off lesion in the alveoli called a tubercle. It liquefies and ruptures your tissues, and the bacteria can spread. A lot of these things spread through the lungs through these little pores of cone. Pores of cone. Streptococcus is actually 2/3 of all cases of pneumonia is streptococcal. Typical pneumonia, we call it pneumonia. Atypical pneumonia are all the case, maybe pneumococcal, Streptococcus pneumoniae, mycoplasma, legionella, could be Q fever, Haemophilus influenza, it could be chlamydial. But basically, your fluid enters the alveoli and the bronchioles are constricted, so you're going to have pneumonia. So loads of things cause pneumonia. Very important. There's viral pneumonia as well, which can happen from the flu, it can happen from chickenpox, and measles. Influenza in the respiratory system, these are viral diseases. Influenza, the flu, influenza viruses. There's chills, fever, headaches, muscle aches. This is not the stomach flu. Stomach flu is not influenza. We always have our stomach bugs. There's alteration in the spike proteins that evade the immune system. They call that antigenic variation, antigenic shifts. It changes so much, and this is why you have to have a different flu shot every year. We have different flu shots. Common colds, 50% of these are rhinoviruses, about 15-20% are coronaviruses, which, for example, SARS-CoV-2 that causes SARS-CoV-2 causes COVID. Sorry, my brain blanked there for a second. And then 10% are just other viruses for common colds, but rhinoviruses are by far most of them. 50% is rhinoviruses. Okay. So now let's talk about that can affect respiratory, but they show up and display on skin. These are fungal. Histoplasmosis, Histoplasma capsulatum. It looks a lot like and presenting like tuberculosis. You'll get lesions. It's very yeast-like, almost filamentous it becomes. River Valley, Ohio River, things like that, Mississippi River, the river valleys. So coccidioidomycosis, valley fever, Coccocoides imitius. It lives in dry soils. You inherit from the dry soils. Pneumocystis pneumonia, and it infects the lining of the alveoli as well. You get this in compromised hosts. Compromised hosts tend to get some of these really weird fungal infections that nobody gets. We'll talk about some microbial things that affect digestive. We'll talk about oral, starting off with dental caries. This might be some kind of actinomyces or S. mutans that form a plaque. Gingivitis is an infection of the gum. Periodontitis is the gums inflame and they bleed. Can lead to some pretty bad, there's lots of things that can lead to this periodontitis infections, gingivitis and things like that. Bacterial diseases, typically they're fecal-oral route, usually from something's butt to your mouth, okay, if something's poop. The fecal-oral cycle, we might call it, or fecal-oral route. These things are, biggest thing is sanitation, okay, is us having proper water sanitation, us following proper sanitary procedures, washing, things like that. So an infection where the pathogen enters the GI tract may lead to intoxication because there's a toxin. It may be a Staphylococcus aureus that does the aureus. The dysentery, that's diarrhea and blood and mucus. Diarrhea with blood and mucus, we call that dysentery. Gastroenteritis, that's going to be an inflammation in your stomach and intestinal mucosa. Let's talk about some diseases that can really that do this a little bit. So staphylococcal food poisoning is usually a staphylococcus intoxication. There's lots of things that it can produce. Is food toxins. Cooking doesn't destroy it. Sliced meats, puddings, pastries can all, so the toxins are resistant to heat. And these toxins, you cook it, you still get it, you get really sick from it. Cholera, Vibrio cholera. The enterotoxin causes severe secretion of water, severe diarrhea. Clostridium difficile, C. diff. This causes bad diarrhea. If you go on antibiotics for a long time, you deplete your normal flora, killing the competing bacteria. The Clostridium difficile takes root, overpopulates, so really common to get this in hospitals and nursing homes for people who are on antibiotics. All right, let's talk about shigellosis. Shigella, we call this a bacillary dysentery, a bacterial dysentery. Shiga toxin destroys your epithelial lining, so you're going to poop your guts out. You're going to have up to 20 bowel movements a day. You're going to poop your guts out. Okay, that's how my micro professor put it. You're going to poop your guts out. I do apologize for any mispronunciations to any scientific names. It has been a long time for me, so I primarily have been teaching others. So a lot of these bacterial disease, you eat a food that has the disease, bacteria might be killed, but the toxin survives. The food is contaminated with the toxin to competing another thing that happens, food is contaminated by somebody. Food containing the protein is cooked. Somebody poops, they touch the food, they handle the food, they don't clean their hands after eating it. The food is left at room temperature, the bacteria grows, so you would contaminate the food. Somebody pooped, didn't wash their hands, go and handle your food. The food sits at room temperature, it incubates the toxins, even if you cook it. Reheating may get rid of the bacteria, but not the toxin. The toxin gets eaten, and you can get really sick about 1 to 6 hours. The toxin. We'll talk about these toxins, what they do. Many of these toxins, what we call AB toxins, and things like that. We'll talk about them as we go. Now, we'll talk about salmonella, another thing like that. Very easy, salmonella. Salmonella enterica and Salmonella typhimurium. So they are found in animals. Salmonella, you might get them on the surface of turtles and stuff like that. They replicate. They go macrophages of what's called M cells is where they replicate, and they call it diarrhea and severe cramping. Typhoid fever, Salmonella typhi. It's the most virulent. Feces in humans, we have poor sanitation, high fever, diarrhea, spleen gets infected, liver gets infected, and it spreads really nasty. E. coli and E. coli gastroenteritis, we call that traveler's diarrhea. Watery diarrhea, it's like a mild cholera. You get this from going to places, traveling around, eating foods from different countries where they don't have the same levels of sanitation as you're used to in the developed world. The Shiga toxin E. coli. It's an E. coli that makes the Shiga toxin. Gastroenteritis can be caused by Campylobacter gastroenteritis, Campylobacter jejuni. Yersinia gastroenteritis, another Yersinia. Yersinia pestis is not the only one. Yersinia enterocolitica. Clostridium perfringens is a gastroenteritis, and a Bacillus cereus, B. cereus gastroenteritis. Always like B. cereus. Bacillus cereus. Okay. The bacterial diseases can continue on with H. pylori, Helicobacter pylori ulcers. This is our ulcers. What basically happens is Helicobacter pylori get in. It starts infecting. Enzymes neutralize. Normally, urease neutralizes stomach acid, so the peptic ulcers and allows them to survive, and it starts to damage the intestinal lining. But they actually proved that Helicobacter pylori caused ulcers by the guy. He swallowed a culture of it and got ulcers. Some other really nasty viruses that we can get that can be pretty nasty. Many of them are fecal oral. We'll talk about from something's poop to your mouth. Mumps virus, painful swelling of your parotid salivary glands right here, saliva, respiratory secretions. So coughing on something, you get it in your mouth. Hepatitis, many of these are fecal oral. Your liver swells. Hepatitis A, hepatitis B, and hepatitis C. Hepatitis B is one of that's caused by sexual contact. Hepatitis A is fecal oral. So parenteral, other than digestive system, you get it from sex. Chronic hepatitis is parenteral. Viral gastroenteritis, rotaviruses in children, neuroviruses, fecal oral. Aerosols, you vomit and aerosols out and spreads, you get it. So a lot of times you may get it from cleaning, from somebody puking their guts up, somebody vomiting pretty heavily. These protozoan diseases, these will cause you to poop your guts out, many of these. Giardiasis, I call it beaver fever. Giardia lamblia. Amoebic dysentery, Entamoeba histolytica. Contaminated water, you poop your guts out again, amoebic dysentery. Cyclospora diarrheal infections, Cyclospora candidiasis. Watery diarrhea, again, you poop your guts out. Cryptosporidosis from a cryptosporidium, also contaminated water. So a lot of things, you drink water, you may get a protozoan from drinking contaminated water, bouillure water, things like that. Helminth, tapeworms. Helminth means worm. Tapeworms, they are in your intestines. The eggs go to the feces, so you will see the little football-shaped eggs in the fecal Tinea sanguinata. That's the beef tapeworm. They can live 25 years and get 6 meters long. 6 meters, I mean, a person is around 2 meters. That's pretty tall that's a pretty decent person. Tinea solanum, that's your solium. Sorry, not solanum. Solanum is tomatoes. Sorry, sometimes I will say things. Tinea solia. Tinea means ribbon. The pork tapeworm. That's where you get your infection with the larval stage. It's trichinella, things like that. We'll talk about Tinea solium. You can get cystirosis. Ophthalmic cystirosis, you get this in your eye. Neurocysterosis, it's very serious. You get it in your tapeworm. Another one is a fish tapeworm called Diphyloborum latum. Sorry, sometimes I have with some of the things I've that's older for me, it can be hard for me to say a little bit. So let's talk about helminths. They can go into your brain. Hated disease, Echinococcus granulosus. This is a very small tapeworm. Get it from eating deer that's encysted. It gets in with a cyst. That should say with cyst. I usually was trying not to use abbreviations, but I was writing. I was trying to get these done really quickly. These were at the very end of I actually wrote these last, the diseases last. Hookworms, there's many species of hookworms. They feed in blood in your intestinal wall. So because they feed on blood, you get anemic, you get lethargic. Pinworms, Enterobius vermicularis. There we go, let's say it right. Sorry, I'm saying these live. I'll put Ascaris lumbricoides, ascariasis, the intestinal nutrients as well. They're tropical, but you can get their eggs. People bring them with them. Trichina worms get in undercooked pork. Not something we worry about as much now, but it's a round worm, lives in the muscles of pork. Trichinella spiralis. There are bacterial diseases of urinary and reproductive. These are many times STDs or STIs. We now use STI preferred. When I was a student, it was STD. That just implies your signs and symptoms, sexually transmitted diseases. STI, sexually transmitted infections. But you may not show signs and symptoms with the infection, but you have it. Gonorrhea, Neisseria gonorrhea. It's gonococcal. It actually goes to mucosal cells and epithelial wall of your tract. It can affect your urethra. So one of the ways, they called it the clap. One of the ways they would treat it, they would take the penis, they would put the hand, and they would smack the heck out of it to squeeze the pus out. So that's why it's called the clap, we think. Maybe, or maybe it was because an old name for a vagina of a prostitute was called a clapper. We're not sure, but we called it the clap. It can affect the cervix, it can affect the eyes, the rectum, and the oropharyngeal area. Basically anywhere that, as gross as it sounds, seminal fluids may come in contact carrying the gonorrhea. So ophthalma neonatorum, this comes from a woman who gives it to her offspring when she is infected with a bacterial disease. She may give her baby an eye infection, ophthalmia. Chlamydia, Chlamydia trichomatis. It's really unique the way it reproduces, but it gives risk of cervical cancer in females. It's what we call a non-gonococcal urethritis. So it burns when you pee. Syphilis, Treponema pallidum. You get cankers that go to a skin rash. You get gummas. These are gummas. This is late stage tertiary syphilis. Once you have it in tertiary, when you're seeing gummas on people, they're going to die. Gummas are seen on tertiary syphilis patients. When they are tertiary, there's no going back because we live in antibiotics. People do get tertiary syphilis. You'll be very happy when you die. You'll be euphoric as tertiary syphilis. Girl, you must be stage 3 syphilis because I can't get you out of my head. It's forever. Genital herpes, herpes simplex, virus 2, herpes simplex 2. You get lesions, it burns, it goes away and comes back, it reoccurs. Genital warts are caused by papillomaviruses. Human papillomavirus, causes genital warts, but it also causes cancer. So one of those things with the human papillomavirus you can go get vaccinated against. HIV, the lentivirus, it depresses your immune system. It destroys the C4 helper T cells. Cancer, viral, fungal, protozoan diseases, things that you never got before would just come out. This is a little bit out of date, but we see sub-Saharan Africa has really high levels of HIV/AIDS. So it's still a really big hotspot for HIV/AIDS. I'm sorry for some of the mispronunciations. It's been a long time for me. I'll redo it with freshening up on my stuff. And guys, this completes this video. Keep working on these all throughout the semester. I'll do quizzes each week on early stuff as we progress to the end, and then a quiz on diseases all by itself, and then it'll be on exam 4 in the final. Okay? All right. Thank you guys, and I'll see you in the next one.